Atrial fibrillation refers to a chaotic and very disorganized atrial contraction. Instead of an organized atrial squeeze, it becomes very disorganized and starts just twitching like this. With the result, instead of pushing the blood, it's just the blood stays and moves passively. And that condition is called atrial fibrillation. Increasingly, we realize atrial fibrillation significantly increases the risk of stroke. One of the most worrisome side effects or the complication of atrial fibrillation is a paralytic stroke. So what happens here is a small clot forms in the heart because the heart doesn't beat regularly. It allows the blood to kind of pool around in the same place and form a small little clot. This clot moves to the brain and a small segment gets occluded in the brain, leading on to a permanent deficit for the patient in terms of loss of speech or loss of power in the upper and the lower parts of the body. Stroke is the most worrisome side effect. Second problem with atrial fibrillation is that it increases the risk of heart failure. So patients develop poor pumping efficiency because of atrial fibrillation. If you correct the atrial fibrillation, the pumping efficiency is likely to improve. Third, increasingly we realize is it increases the risk of death among both men and women if left untreated due to several mechanisms. One is stroke, one is due to heart failure. All vascular events are more common in the presence of atrial fibrillation. And increasingly we have realized this is one of the reasons why people develop dementia, forgetfulness, memory loss. These things are related to atrial fibrillation in the long run. Atrial fibrillation in a vast majority of patients can be silent. During sleep, they may have a little fluttering, they may not even be aware of it. But the common symptoms are transient palpitation in the heart, where they feel their heartbeat that is irregular. They can also present as increasing breathlessness or chest pain. Sometimes when the rate is too fast, they can suddenly faint because the blood is not pumped to the brain doesn't receive enough blood flow and they can suddenly faint. So fainting, breathlessness, periodic chest pain, palpitations can all be manifestations of atrial fibrillation. So please, if you are a diabetic or if you have hypertension, if you suddenly feel some kind of fluttering in the chest, don't ignore it. Go and seek the help of a physician or a cardiologist, a medical professional. Get this. This is a very simple test. You can do a 24-48 hour monitoring to see whether there are episodes of atrial fibrillation. The physician will then assess your risk of stroke, whether there is a risk of stroke developing, and they can be very effectively prevented these days by safe medical therapy. Atrial fibrillation is diagnosed. If you want to be 100% certain, you need to get an ECG at the time of atrial fibrillation. So there are several treatment options. The first and foremost is we identify the reason why the patient has atrial fibrillation. He has got an underlying valvular disease that needs to be corrected. He needs appropriate medical therapy to prevent stroke and control the heart rate. And if the rhythm continues to occur in spite of these things, atrial fibrillation is recurrent, there are very safe ways of what is known as catheter ablation for atrial fibrillation. Increasingly, we use balloons called cryoballoon, where it goes and freezes the sites. Generally, the atrial fibrillation comes from these veins behind the heart. Once it is frozen, there is almost 80 to 90% success rate that you will be free of atrial fibrillation in years to come. So catheter ablation for atrial fibrillation is very useful in patients where they have intermittent episodes of atrial fibrillation and they are not well controlled with medication. They are put on a small dose of medication and they are not able to control the symptoms. Or while on medical therapy, the patient develops atrial fibrillation again and again. Or thirdly, patients who have paroxysms of atrial fibrillation, there are episodes of atrial fibrillation which become persistent, which becomes permanent or persistent. Before it becomes very persistent, you should offer catheter ablation. They are the ideal candidates. So cryoablation is a form of therapy where instead of using heat to destroy these areas which produce abnormal electrical impulses, cryo is cooling these spots. Instead of doing point by point, we put a balloon and freeze the whole area in one shot. It is a simpler procedure, shorter procedure duration, and the efficacy is almost the same as RF ablation. If you are a diabetic or you have high blood pressure, then you need to look for evidence of atrial fibrillation by screening, either by ECG or Holter, so that early onset of atrial fibrillation is picked up. And if it is there, interventions can be offered early so that it doesn't progress further.